So the race to vaccinate has achieved some significant milestones in recent days, and officials are taking steps to ease the pandemic restrictions. So how close are we to end all of this? It's a question many of you have been asking, and for answers, we will bring in our medical expert, Dr. Arnold Baskies, who's the past chairman of the National Board of Directors of the American Cancer Society and also chair of the Global Cancer Control Advisory Council. Dr. B, always awesome to have you.
Great to see you, Stephanie.
So we have new numbers here. I know that you were excited about this. More than 100 million Americans now fully vaccinated for COVID-19. And that 100 million number, it sounds like a lot, but it's less than a third of the country. And you put that on pause for a second because we talk about the crisis that's unfolding in India, which I talked about a moment ago. So the question is, can we ever reach herd immunity here in the U.S.? And will that herd immunity be at risk if the virus is raging elsewhere in the world?
Well, Stephanie, it depends on your definition of the herd. I think we will get there, but it's going to be very uneven. We'll have areas of the country, unfortunately, which has expressed vaccine hesitancy. And those people will always be subject to get the virus. So at the end of the day, I think in the fall we'll be in a much better place. In a few months, we'll be in a much better place than we are now. I think the COVID deaths are declining tremendously. We still are seeing COVID hospitalizations, and in a younger population, by the way, than was last year. So it's going to be a very uneven process. We will get there. But it would be a lot easier if people would just get vaccinated, and that's the bothersome part of this. 7% of the world's population right now has received at least one dose of the vaccine, which is good. It's got to get better. And as long as we have admixture of people coming from outside the country into the United States, we'll be challenged by that. So the sooner we can get our population vaccinated, the sooner we'll get to herd immunity. So the short answer is yes, we'll get there, but it's going to be a very uneven process.
Yeah, uneven, again, because we have to bring up this other point right now. A lot of the adults who are fully vaccinated are likely going to go back to doing the things that they weren't doing this past year. You know what we're talking about, going back to the office, eating indoors at restaurants with people that don't live with them. But here's the question. What if those adults have kids at home? Because we know that basically nobody under the age of 16 is vaccinated. So should fully vaccinated parents still be concerned about putting their kids at risk?
The answer is no, basically. So the CDC had released a very interesting study last week. Looked at 3,250 healthcare workers who had been fully vaccinated, and then studied them intensively with nasal swabs for 3 months. And they showed that the chances of a vaccinated person carrying the virus is less than 10%. So the answer is, yeah, it's relatively safe for a person who is vaccinated to hang with their children. The good news is that even if the child were to get COVID, which can happen, but it's going to be a very, very rare event, that child should do great. And most of the children, the vast majority of children who get COVID are either asymptomatic or get a mild case of the virus. So the answer is that would not be high on my list of things to be worried about. My main concern right now is the people that don't want to get vaccinated or are vaccine hesitant and are following internet rumors and not getting vaccinated. That group is going to be a problem for the rest of the country as well as for themselves.
I'm really glad that you brought up that last point. I want to leave people on this point here. You're the expert here. What are good websites for people to check out if they want to do their own research, right? People always say, I'm doing my research, but it depends on what website you go to. You can't, just because it's on the internet doesn't make it true.
Oh, very, very true. So there are some trusted websites. The hospital websites are very good. The CDC's website, even if you don't trust the government, is a good site. And the best studies out there have been published and are regarded in well-versed journals. But at the end of the day, there's so many bad internet rumors out there. There's one rumor that it causes infertility in young girls, which is absolutely false. That it's not safe if you're if you're lactating and breastfeeding. These rumors are terrible, and they have been destructive, and unfortunately, too many people pay attention to this. So if you want good information, go to a trusted source like the CDC. Believe me, they do not publish falsehoods.
Yeah, CDC, and also check out your local hospital websites and things like that, and your local health departments. Good sources. All right.
Yes.
All right, Dr. Arnold Baskies, thank you so much for joining us and sharing your insights. Always good to see you on a Sunday. Any day, really.
Thanks, Stephanie. Same here.
Thank you.